Hey everyone, it's Dr. Adams with the Cleveland Clinic Chiropractic Group again. Today we're going to be talking about some shoulder pain home self-care ideas. Keep in mind that your symptoms may be different and one of our other videos could be more appropriate for you. So make sure that if this one doesn't work out for you, that number one, consult with your physician before trying any of this at home, but maybe get a little bit more direction from them, or try one of our other treatment protocols that you can find here on this channel. Now, what we're going to use is our same protocol that we always use, is that we want to try to identify, if we were to put into body language, the type of pain that we're having. So if you were to think about it, if I were to ask you, hey, why don't you point to or show me where your pain is? If you find yourself starting at one area and kind of running your fingertips down to another area, well, that's going to take a very specific type of treatment. And as always, for this type of treatment, if you've watched some of our other videos, we're going to use the thumb for this, or any other kind of device if you have one of those Theracanes or something else to kind of dig into the tissue. I like the thumbs just because I can get in there and feel what's happening a little bit more. Now we're going to use the tip of the thumb, and again, I'm going to bring my thumb into this position, and I'm going to be pushing into the tissue with some pretty moderate force. Now let's say again that I start feeling some pain right up here at the shoulder joint itself, and it's going to travel down my arm. Well, I'm just going to follow that line, as it were, that directionality of pain. And I'm just going to take my thumb and push moderately into those tissues, and I'm going to drag down that line of pain that my body language was displaying. Now again, I'm going to use some moderate force, so this is going to be uncomfortable, especially on the tissues that are a little bit more compromised. As I push in through there, it's going to be uncomfortable. Again, don't kill yourself. We're going to use some moderate force, but I don't want you to be too heavy-handed. So nice and easy through here, and I'm going to take several passes through that tissue. Let's say 5 or 6. Now, let's say you're the type of person that has some pain that if I were to ask you where it was, you took the kind of the flat part of your fingers and you're kind of digging and rubbing all at the same time. Well, in this case, we're going to use the thumb, and now we're just going to use direct pressure. So I'm going to use the whole of my hand, and I'm going to grip my shoulder, but I'm going to take that thumb and I'm going to try to push into that area, again, with some pretty good force. Now, I could also use a lacrosse ball if I wanted to put it on the floor and maybe drive my shoulder into it. In this case, since we're using the hands for the other treatment, we'll just go ahead and use the hands. So I'm going to take my thumb, and again, I'm going to use some pretty good force, and I'm going to push into that tissue, and I'm going to hold. Okay? And for how long you hold, I'll kind of leave that up to you. I would say maybe spend at least 10 to 15 seconds on here, and you might actually take your thumb and maybe fish around just a little bit, and you might find that there's some more sensitive spots in there. I don't want you necessarily to avoid those. Again, that's going to be a little uncomfortable. Try not to push too hard, but I'm using some pretty moderate force in there. I'm finding the direction that brings on some of the most tension and discomfort, and I'm just going to hold about 10 to 15 seconds, okay? Now, let's say when I ask you to show me your pain, you do kind of a flat hand, and it's a sweeping motion down from your shoulder down to your forearm. Well, the treatment's going to be very similar to that action in that we're going to use the whole of our hand, and we're going to use a sweeping, squeezing motion. So I'm just going to take the whole of my arm, and I'm going to squeeze down this way in that direction of the pain. So I'm going to go from my shoulder towards my wrist, and I'm going to squeeze this all the way down. So I'm not going to stop at my elbow. I'm going to squeeze it all the way down to the end of my hand here. And I'm just kind of milking this all the way down, using some pretty good force through those tissues. So these are some of the common body language signs that we get when it comes to shoulder. I'm going to show you one other that's not going to be in the exact shoulder, but it's going to be in this area from the edge of your shoulder here to the side of your neck, and it's going to be above your collarbone. So if you can find that bony part of your collarbone, and if you come up or towards your shoulder, you'll find that there's a bit of a dip in the tissues. In here, if you kind of fish around, so I'm just taking my fingertips and I'm pushing in there. If you kind of fish around in there, you might find a couple of spots that are really, really sore. Quite often, these points right here can give us problems with the range of motion in the shoulder itself. So we want to address these. Again, we're going to use the technique of our thumb or something that we can push directly in there. So again, if you have one of those soft tissue canes that is kind of the hook that you can push in there, that would be appropriate. Again, we're just going to use the hands for today. So I'm going to use the same side. In this case, it's my right side, so I'm going to use my right hand. And I'm just, as if I were going to comb my hair back or answer the phone, I'm going to use my thumb and I'm just going to put it right into that sore spot. And I'm going to push from the top down. So I'm pushing right into that. If you need to use your other hand to kind of help push your thumb in there, again, this one is going to be very tender. So be very gentle on yourself, but what I call appropriately aggressive, right? So we're going to be efficient, but not a torture session. So I'm holding in here for about 10 or 15 seconds. I might fish around a little bit more to find some of that more tenderness, and then I'm going to come off. Okay, so those are some different ideas for the self-myofascial treatment. Now again, we also have a shoulder-specific video in our three-dimensional range of motion, the CARS motion, those controlled articular rotation. That's the next portion of the protocol. So just for example here, remember the full range of motion of the shoulder is we want to bring it up into flexion. I'm keeping my elbow straight. I get as much rotation as possible. As it swims around to the back, I keep rotating. Ultimately, my hand is going to stop at the side of my leg with my thumb facing backwards and the back of my hand touching my thigh. The reverse of that is I'm going to come up, rotate through, and swing this all the way around in as tight and controlled circle as possible. Again, kind of look back at the shoulder CARS, C-A-R-S, the controlled articular rotation, for more explanation of this. The other videos that we have for the shoulder are under the isometric contraction videos. It's what we call pails and rails. So it's important to address the internal rotation of the shoulder and the external rotation. So the rotation this way and that way. Those videos in some time-saving efforts for this video, I'll have you consult with those videos. So after you do the self-myofascial release, we're going to go into the big range of motion, those controlled articular rotations. Again, there's a shoulder video for those. And then I want you to go into the expansion and stabilization portion of the home treatment, which is going to be the internal and external rotation, pails and rails. Those are under our isometric contraction playlist in this YouTube channel. So check those out, try those. And again, if this protocol doesn't work specifically for you, make sure you consult with your physician and then try some of our other videos. Maybe your specific problem is just a little bit different than this general approach. Thanks for tuning in.